Hi, I'm Garvin Lynch. Welcome to Lynch's Pharmacy Health Video Series. This video is on the treatment of diarrhea. So the most important thing is to treat dehydration, to increase the patient's fluid intake. As a rough guide, after every bout of diarrhea, the patient should drink about 200 mils of water. This is in addition to the 2 litres they should be drinking every day. So it's very important to drink this water after any bout of vomiting or diarrhea. If it's vomiting, wait 5 or 10 minutes first, then start drinking. But drink more slowly than they would after a bout of diarrhea. Sip every 2 or 3 minutes. But again, after every episode, to get 200 mils of water inside you, and that's in addition to the 2 litres a day you should be taking anyway. Again, as a general rule, over the course of 1 or 2 days, bouts of diarrhea up to 4 times a day in a child generally won't put them at any risk of dehydration. But again, it depends. If it's a very young child, a very good way of detecting dehydration would be to pinch the skin at the back of the hand and then let it go. And if they're dehydrated, there will be less elasticity in the skin and it won't return to a normal shape that quickly. Whereas if they are hydrated, it'll just spring back into shape. So it's just a useful quick test. It's more used in babies than young children. For most adults, the fluid that they do drink will ideally be water. But if they can't, then they can drink fruit juices or soup. Stay clear of drinks that have a lot of sugar in them, as they can actually make diarrhea worse. In terms of babies, breastfed babies should continue to feed if they're sick or have diarrhea, but bottle-fed babies should stay off milk for 24 hours and just take rehydration salts. Then the next day dilute their normal milk amount to a quarter of what they usually get. The day after that, dilute it to a half, and the day after that, dilute it to 3/4, and then back to the full strength the day after that. So that's for bottle-fed babies. Breastfed babies can continue to feed as normal. So rehydration drinks are recommended for people who are very frail, elderly, over the age of 60, 65, or for babies, as I've just said. They're basically just a mixture of sugars and salts. They replenish the electrolytes you lose when you have diarrhea or when you're getting sick. Basically put 1 sachet into a cup of water and drink it every time you have a bout of diarrhea or get sick. They don't reduce or stop diarrhea, but as I say, they replenish those electrolytes and are good for preventing dehydration. Diarrhea comes in various different flavours. There's blackcurrant, natural and citrus ones. As I've said before, it's important to eat as normal as possible. Let your stomach guide you, but pay attention to the foods you do eat. So things like wholemeal bread and rice are good. So I'd normally tell people or patients to avoid anything too heavy, like spicy meals or anything like that. So if the patient needs medication, anti-diarrhea drugs are not normally needed, but the patient may want them if the diarrhea is causing them particular stress. So the safest ones are Imodium and Arete. They both contain a drug called loperamide, which basically slows down the activity of the gut and should stop the diarrhea. Imodium has loperamide, as does Arete. Imodium Plus has loperamide, an ingredient called simethicone, which is good for relieving trapped wind and the feeling of bloating. All to be used only from the age of 12 up. The usual dose is 2 at the start and then take 1 for every bowel motion they have. The Imodium and Arete you can take up to 5 a day for no more than 5 days. For Imodium Plus, just take 4 a day for 2 days. And next we have Carpamine, which is generally used for pain and cramps in the stomach, usually associated with IBS, irritable bowel syndrome. But if the patient has cramps and pains in their stomach associated with diarrhea, by all means it's a good choice. It's just peppermint oil and works very well for most people. And after that we have particularly bad pain or fever, just plain paracetamol or ibuprofen can often help as well. So as I've said, if the symptoms are very bad or if it has been going on for a long time, I wouldn't go for any of these products. I just go to your GP, because diarrhea can be associated with some nasty illnesses. So just to be sure, use guidelines which I've gone through earlier, and if you meet any of these, you'll go to your doctor. Otherwise, you can buy an over-the-counter remedy like Imodium, Diarrhea or Arete or Copperman. And new onto the market is Buscopan, which is not for diarrhea but for irritable bowel as well. If you have any question, you can contact me through the Life Pharmacist on the website. You can email me or call into the pharmacy in Broaddale in Douglas, up Maryborough Hill. Thank you for watching.